welcome back. If you're joining us, you're watching Channel 1 News Hour. We now shift focus to Health Matters, your health segment. And tonight we talk about mental health, coming at a time when on the 10th of this month, we will be marking the World Mental Health Day. And statistics are showing that at least every year across the globe, 800,000 people commit suicide. And also more disturbing is that people between 15 to 29 years, that is the youth, this is the second leading cause of death. That is depression among 15 to 29-year-olds remains the second leading cause of death. And those, of course, are disturbing statistics. We want to find out what really is happening and how can we be able to stop this, and are there treatment options that are available. For more insight on that, I'm now joined by Dr.Syengo Mutisya from the Ministry of Health. Thank you very much, Dr. for coming to our studios.
Thank you.
Now, can you paint for us this picture of really how prevalent is this problem, especially among the youth?
Yes, this year's theme for World Mental Health Day is mental health and young people in a changing world. And we know that 1 in every 5 young person suffers from a mental health condition. And actually studies done in Kenya have even shown a higher prevalence of up to about that 7.7%, which is higher than what has been seen in other countries in the Saharan Africa. And so it's a big concern for us because, again, our population, Kenya population, 60% are young people, because we know 0 to 14 years, they are about 40%, and 14 to 24, they are about 19%. So our population is basically young people, 60%. Yes.
So what is happening to our young people? Why are a lot of them undergoing depression?
A lot of factors can contribute to increasing depression and other mental health conditions. One, there's a lot of pressure in our academic system. There is also, for those who have graduated or finished school, there is also a lot of unemployment. And there's also, in some areas, conflicts. And as those other factors increase and affect the adults, the young people are also being affected.
So it's largely environmental from what you say?
Yes.
So how can, in terms of accessing treatment, how many of them can be able to get that help?
Yes, I think basically we need to sensitize young people so that we can promote their mental health, we can prevent mental illnesses, and for those who develop mental health conditions, because we know as much as young people go through change of school, they complete school, some young people are looking for jobs, many of them would go through that process without any problem. A few of them would develop mental health conditions. So we need to sensitize them to realize when things are not okay. Many of them resort to using substances to deal with the problems. So we want to sensitize that if you don't feel well enough, if you feel sad, you're not enjoying things you used to enjoy before, you don't feel as energetic. Interesting, young people and children, when they are depressed, some of them could become irritable, and you think they are disobedient, you think they have a conduct disorder, but it could be depression. So for the family members, the parents, and the extended family, and teachers who spend a lot of time with these young people, they need to, if they spot any of those changes in behavior, to refer them for treatment. Yes.
There's this argument that keeps coming about, mental health and bang being a treatment option. Do you think this is true? There's actually even a member of parliament who is crafting a bill to try and, legalize bang use.
Okay, we know that even in countries where they have legalized cannabis use, there is an increased rate of psychosis that has been shown in all the countries and states which have legalized marijuana. And we know that use of bang, especially for young people who are below 24 years, basically their brain is still developing, and chances of them getting addicted are higher. And the fact that in Kenya, even prescription drugs can be bought over the counter. So it means even if you legalized another substance, then they can easily, even the young people who are below 18 will still be able to access it. So for me, based from with the facts of what has happened in countries where they have legalized cannabis, they've seen increased rates of psychosis. So for me, I would
mental
hesitate
illness actually goes up,
yes,
it doesn't go
yes,
down.
Yes.
All right, within our, our institutions, our schools, our workplaces, are we seeing efforts towards trying to address the problem of mental illness? Are we seeing, counseling services? Are we seeing, people being able to access treatment within this particular environment?
Yes, I know most schools have guidance and counseling teacher, but I think we will see more benefits when we change the system from the 844 system, which is very intensive. Probably when we change the system, we will be able to have our children relax and be able to realize their other talents. They would also have time for learning life skills, because you discover that with 844, it's very exam-based, and maybe the time which would have been used for physical exercise and for learning life skills goes to academic work. So I think when we eventually change the system, we would see better children with better mental health. Yes.
But in terms of facilities, are there sufficient facilities within, the schools and the workplaces that can be able to address the problem of mental illness, where people, can be able to go and talk about their issues to, a professional?
I think basically when we improve on physical health, like if people are able to exercise, they are able to talk about their daily challenges, they have supportive environment, if it's a family, if it's a school. Studies have shown that when students feel connected to a school and they feel that they are supported by the school staff, they do better even academically. And so the emphasis is to make sure that the environment of a child, which is the parent and the school, is supportive. Workplaces, of course, need to be better. In fact, now studies are showing that even going into the nature and helps in mental health. It's close to some forms of psychotherapies. So you find that many schools have very small space for physical activities, which is
somewhere in a building, there's no playground.
Yes, and our parks in the city are not very spacious, so maybe we can do better. Yes.
All right, in terms of, support groups to build around persons who already have these mental illnesses, are there places that, the way we have AAA for those who, are recovering alcoholics, what about for persons who have mental illness? Is there a place that they can go together and talk about their issues, a support group per se?
Yes, basically we have several support groups. Like we have users of psychiatric services. We have various groups which meet in different locations, but majority of them are for adults. So I think eventually when we have peer supporters, especially for those in schools and in universities, that would work better for the young people. Yes.
All right. Just looking at the theme that you're celebrating, marking this year, rather, the issue about the youth. What is it that you want to do differently for the youth to try and address the problem of mental health?
We know now with the emerging technology and the fact that the youth at a touch of a button can get a lot of information. There is advantages to that you can circulate information in forms which they can easily access, and when they search, they can actually be able to get a lot of information. And we realized during the World Suicide Prevention Day, which was in September 9th, we were able to reach many people through social media talking about mental health. And on 9th of October, the day before the World Mental Health Day, we will also have another intensive social media campaign to which we hope we'll be able to reach the young people, and the actual World Mental Health Day. But we want this to be ongoing so that they can actually be able to get the information.
So which information is it that you want to get out there in this particular drive on the 9th, just before you have the event on the 10th?
So basically, people need to know, how do you know that you have a good mental health, that you are able to enjoy life, reach your potential, adjust to any adversities in your life, and be able to contribute towards the society. That is good mental health. How do you realize when you start having problems that your mood is affected, that you are not as happy, or in some cases the mood could switch to the other end where you have very high mood, your thoughts have changed. Maybe you used to be very optimistic, and you start having negative thoughts and behavior, that your behavior changes. So those are some of the things will notify you that things are not okay. So once we want to sensitize the members of public to be able to realize when things are not okay, and be able to look for help. And it is okay to look for help. It doesn't mean you are weak. So that people don't suffer in silence. And we know that if you don't treat depression, for example, the worst complication could be suicide, which we want to prevent, because suicide, you can prevent suicide. Yes.
And how are you going to target, the people within the society, their parents perhaps, or, those who live with them, their guardians? Because the youth, yes, are very active on social media, but, you can't help them in isolation, because their parents will obviously be affected, and there's the issues around stigma around it. So how will you target this particular group in your campaign?
Yes, we thank KBC for giving us this opportunity to talk about mental health, because I know it's not the youth don't watch news. It's basically the adults who watch news.
You'd be surprised.
Even as we talk about mental health on TV, we are also reaching to the members of public. But stigma is very big when we talk of mental health, that people can easily say, I have cancer, or they can easily say, I have a fracture, or they can easily talk about other physical issues. But when one is depressed, when one is anxious, when one has bipolar, when one has ADHD, when you talk about it, then people start seeing you differently, even at workplace. So many people will not talk about it. They'll suffer in silence, or they will look for treatment in privacy. And that means if they have to talk about it, that they have to disclose it for them to be given permission to go and seek services, then it bars them from seeking care. So we need to break the stigma by many people coming out and talking about their struggles and successes, even when they suffer from various mental health conditions, so that we can see it like any other illness.
Are people willing to tell their story? Because I know with HIV and AIDS, people tell their story, and it's sort of, encourage those who also, find out they have HIV and AIDS. But in terms of mental illness, the stigma that still surrounds it, and the fact that, maybe a family doesn't even want people to know that you have mental illness. They want to hide you in the house, or they just want to go and throw you in some center and forget about you. How are you trying to encourage people to come out and speak about their condition?
Yeah, even in 80s, when HIV was beginning to become aggressive, people were shying off about it. In fact, no one wanted to interact with somebody who was said to have suffered from HIV/AIDS. But with time, we had also the political support and involvement. It was declared a national disaster. And with time, that stigma died. So I think even for mental health, the more we talk about it, the more we get, like we saw the president becoming an ambassador for the youth, and the theme being mental health, young people and mental health. We hope that it could interest the highest level, so that if they support political support and support from even the leadership of the Ministry of Health, then the stigma can actually be brought down. Yes.
But are we putting our money where our mouth is? Because Kenya is among one of the countries that, doesn't specifically have a budget for mental health. How do we change this?
I think now that health is devolved, every county will have to take care of all the health needs of their population. And as we sensitize the members of public, we are sensitizing everybody. We know also the Ministry of Health, National Ministry of Health, role of policy and setting guidelines and regulations. So, and also as we talk about universal health care, we hope that, and we believe that mental health is also going to be catered for in universal health care. So with time, we are going to see things improve, but until people realize that it's an illness that can affect each one of us, then we won't be able to put the money. We know that, like cancer, for example, when we had people at the top suffering from cancer, they took it seriously. So if mental health, if people can realize that it can affect members of their family or close relatives, or it can affect them, then they will take it seriously. And I believe mental health cuts across, mental health conditions, they cut across all anybody can suffer from mental illness. So if it were not for stigma, many people will be talking about it. So as people continue sensitizing about mental health, things will improve and things will change. Yes.
As you talked about, counties, are there particular counties perhaps that, a study has been done that show that maybe there is a higher rate of, people with mental illness as opposed to others? The statistics by county.
Basically, the studies we have maybe a different condition for a different region, but basically everybody can suffer from a different a type of mental health condition. We know substance abuse is a major issue.
Yes.
And substance abuse cuts across. If you go to the coast, you'll find injectable drugs, but if you go to Central, you find more of alcohol. So different drugs are abused at different levels. Some places you'll find higher rates of the severe mental illnesses, and other places you'll find a lot of depression, anxieties. But overall, every county members can be affected by any type of mental illness. Yes.
But in terms of accessing the services, inpatient services, where is it that, some places where those with mental illnesses can go to? Because we mostly think about, Madari, and we always think about, the inpatient. We never talk about the outpatient.
Yeah, basically every hospital, private and the public hospital, should actually be able to provide basic mental health care, because every doctor, before they graduate, they learn about mental health. They are able to treat common mental issues. The nurses as well, and the clinical officers. So all the way from health centers, from the sub-county hospitals to the county hospitals and the national referral hospitals. The key thing is to be sure that if you cannot manage up to a certain level, then you refer at the right time. But there are some counties who do not have an inpatient facility, and there are some counties who have not employed psychiatrists or psychologists. A few of them, about 14 of them, have inpatient psychiatric facilities.
Out
and
of
they
the
have
47?
Yes.
So that is a small number.
Excluding the national facilities.
Yes.
So with time, we hope that they'll realize that mental health affects your productivity, it affects school performance, and so if we are going to eliminate poverty, then we have to make sure that people can realize their potential and they have good mental health. Yes.
Sorry, I'm informed our time is up, but I just want you to look into that camera and perhaps talk to the youth in terms of mental health. What is it that they need to do, the do's and don'ts, to try and ensure that they stay mentally fit?
I would appeal to the youth that one, they need to avoid using substances, and two, they need to open up to the nearest, closest person. If it's a parent, if it's a school teacher or a counselor, and if you feel stressed out, don't think nobody will understand. Somebody will be able to understand, and they'll be able to refer you for help. So don't suffer in silence. Yes. All
right, thank you very much for your time, and of course shedding more light on what you're doing, especially what you're trying to do to help our youth. Well, I have been talking to Dr. Syengo Mutisya from the Ministry of Health, just putting into perspective mental health as we move to celebrate the World Mental Health Day, which is on the 10th of October. She's saying there's a lot of awareness that is going on the 9th. They'll be having a drive just before the 10th. Therefore, it's important for you, if you're a youth, to get onto social media, or even if you're not a youth, just try to follow this conversation. It can help a person that you know. Remember, the statistics are worrying. 800,000 people globally commit suicide annually, and depression is said to be the second leading killer among youth between 15 and 29. So those statistics, we need to change them. That is where we end Your Health, but business news is up next with Regina Manyara-Gitao.